This session was recorded on the 21st of July 2022 as part of the National Cancer Patient Experience Survey 2021.
Well, thank you everyone for joining us today. And, I'm very honored to have been given the first slot in this session today because, obviously CPES is about listening to patients and getting their feedback. And it's something I feel really passionately about. As Nan mentioned, I am co-CEO of Shine Cancer Support. We are a national charity that supports people in their 20s, 30s, and 40s with cancer. And I'm also chair of the Patient and Public Voices Forum of the NHS England Cancer Programme. And at the end of my presentation, I'll give you a bit more detail on what we do, because I think, wherever you are with your CPES results, we would love to have more links and more involvement with you and to be able to support you while you support your patients. So just in terms of today, I'm just going to talk, I've got 15 minutes. So I thought, this, I'm sure, but I wanted to just touch on and remind everyone why patient experience is important, touch on some of the needs of different groups, and look at how we work with communities and how we can understand, I think, maybe some of the detail behind the results that you're getting, whether they're great results or whether there's something that you can improve. And then also talk about a couple of issues that I've heard bubbling up from the patient community and which may become important to you over the next few months. And then, like I said, talk a little bit about how you can link in with the Patient Public Voices Forum. So I wanted to start, I guess, just by saying that, this is, I think, very important. It should be important to us as a country and within the NHS, but it's also really important to me personally. And that's because, and some of you may well have heard this before, but I was diagnosed with stage 4 diffuse large B-cell lymphoma 12 years ago. I developed it while I was pregnant, and it was very advanced by the time it was found. So it was in my bone marrow, my liver, one of my kidneys. They were worried that it had spread to my brain as well. Thankfully, it hadn't. But as a result of the diagnosis, I actually spent 6 months as an inpatient in a hospital in London. And I think while I was there, I obviously received some really amazing care and treatment, but I also had some really difficult experiences. So, for example, I was actually told that I had cancer while I was alone. I had been in the hospital for a few weeks, and someone came and sort of dropped that bomb and then left. But the flip side of that was that actually one of the nurses on the ward that I was on actually came and sat with me while I cried my eyes out until my husband arrived. And she became somebody who I became very close to. Once I was moved to a hematology ward, she actually came and visited me. And so I was really kind of lucky that although some tough things happened, some good things also happened, and I think we can sometimes underestimate how important experience is and how much that shapes the way that patients respond to their treatment. So I was told when I was diagnosed that I had a 40% chance of survival over the next 2 years, which was pretty horrific because my daughter was 6 weeks old when I was diagnosed. And I found that really hard. I really sort of obsessed over that number. I kept thinking, oh, if it had just been 51% in my favor, maybe that would have been okay. And obviously, I imagine if you are an NHS staff member, it's tough breaking that news, but you also probably have to, shore yourself up against it. So I did have some doctors who were really blunt with that news. But the thing that probably made the biggest difference to me was one of the doctors who used to say to me, yeah, there is a 40% chance that you'll survive, but there is no reason why you can't be in that 40%. You don't have to be in the 60%. You're young, you're fit, you're healthy, apart from having cancer. And that made a huge difference to me and really gave me something to hold on to while I was going through all of the treatment. But I guess it's important to say that there was really no element of my life that went untouched from a cancer diagnosis. And I think very often the way cancer is described in the media is it's a single event that happens and people sort of move on from it. And you kind of, you either, you die or you run the London Marathon and you're a hero. But I think the reality of that is actually much messier. Both my physical and mental health really took a dive. I had worked in international development. I couldn't do that anymore. I lost friends. Some of my relationships really struggled. I had been very fit before I was diagnosed, and I then had to lie in hospital for 6 months being really unwell, which it took me years to kind of build my fitness back up. I was only able to have one child because my fertility was affected. And as a result of a lot of that stuff, I was actually later on diagnosed with PTSD and an anxiety disorder, which I think probably isn't surprising, but at the time it really shocked me because I hadn't anticipated that something that was a physical diagnosis would impact my mental health so much. So I suffered from fatigue. I was demoted at work. It was a really, really difficult time. And I think, as we're looking at patient experience and how we support patients, it's really important to remember that cancer isn't just one thing, it's many things, and it hits your life in many different ways over a very long period of time. So as a result of my diagnosis, I also developed an immune deficiency, which I live with to this day. And obviously during COVID, that's been really difficult to cope with. I've had to be extremely careful. I still am extremely careful. But 12 years later, this is me with my husband and daughter a few weeks ago at an outdoor wedding. So that was great. But I think, the impact of my diagnosis, even 12 years later, on those that are closest to me, they still really feel it. And obviously they've had to live through COVID, trying to protect me as someone who's immune deficient. I did recently complete a triathlon, which I was really proud of, especially because I had to do all of the training outside. So the triathlon was in May. I started training in January, and I thought, right, I'm going to do something because I'm going crazy here. But I had to swim, run, and bike outside because I can't go to the gym inside. So it's been really tough. But I'm obviously incredibly grateful to all the amazing NHS staff that I had who really saved my life on more than one occasion, actually. But I think this is a side that we use quite a lot at Ceinwen in our work. And I think it really strikes a chord with a lot of the patients that we support who, your expectation is, once cancer's done, I'm just going to recover. And the reality is a lot messier. There are a lot of setbacks and feedback loops. And you might have one day where you feel great, but another day where you're really not feeling so well. So I guess that's just a kind of introduction to the question of why should we care about the CPES survey? And obviously all of you are here because you do care. But I think it's really important to remember, even if you get something that you're not happy with, that we all know how the system should work. The value in the CPES survey, I think, is that it can tell you how it actually is working. And very often I have found that, unfortunately, the system doesn't work the way that we think it does or it should. Having said that, I think, there's a lot to really be proud of in the results that you got in 2021. Overall experience at 8.92% with, respondents, that's their average rating. And I think, if you think of everything we've been through the last couple of years, this is actually amazing. I thought, oh my goodness, it's, before I looked at these results, I thought the chance that things are going to look really tough was there. But I think you should all really be commended for that. I think, great that 92% of people also had a main contact within their cancer team. And also that support from hospital staff more generally was really high. So almost 90% of people saying that staff gave them information about how they could support themselves, how their families could get support, how they could go to support groups, that kind of thing. And I really I don't want you to underestimate how important those things are, because I think especially at the moment where people are really struggling to connect with other people, the fact that they've had a good experience and they have support from a main contact, that's huge, and that makes a really big difference to patients. So I think that is really to be commended and well done. Obviously, there's still more to do. And I think there's some things that, while we're building on those great results that we saw, there are some things that we do need to look at. Obviously, some of the results around access to GPs and care from your GPs are a lot lower. We know GPs are under a lot of pressure. I think one thing to think about, and that we need to think about nationally, is in terms of living with and beyond cancer, if a lot of that care is going to be shifted to GPs, but people aren't able to get in touch with them, how are we going to manage that? care planning and immediate and long-term side effects, you can see that a significant percent of patients also felt that they hadn't had the right conversations or got the right information about how they could manage side effects and what their treatment might actually look like. And I think for a lot of patients, actually, that's really important, because patients, you're not just a cancer patient. You might have a job, you've got caring responsibilities, you've got a life you want to live. And it's really important that we make sure that patients understand the impact their treatment might have, either short-term or long-term, but also how they might be able to manage around that and what systems they might need to build in or what support they might need. Similarly, quite a lot of people, you can see only 62.5% said they were given enough information about the possibility of cancer coming back or spreading. And I know from my work at Shine that, fear of recurrence is real, and it can be very disruptive and very hard to live with. So I think it's really important that we can provide patients not only with the information about what it might look like if their cancer comes back, but also with really concrete ways back into the system. Because I think one of the things people really worry about if they're discharged is, what do I do if I start to feel unwell again, or if I find a lump? How do I get back into the system, especially when care from GP practices is not as good as it could be. So more to do, but I think also, a lot of good stuff we can build on. I'm really sorry, my cat is begging to come in, so I'm just going to open my window because he's being really annoying. Apologies. Right. So I think we also we could look a bit more deeply at some of the results that we've got, and look in terms of who's giving us the results that we've had. So we can see from the results, and I'm sure you'll look at this in a bit more detail later on, that people from the most deprived groups give lower average ratings for care. Also, that people from white backgrounds give a higher average rating of care than respondents from mixed, Asian, or Black ethnic backgrounds. And I was actually on a call a few weeks ago with the chief executive from Picker, who was saying, that's not because necessarily people from mixed, Asian, or Black backgrounds have higher expectations. They often actually have lower expectations. So, having lower results from that population means that, things actually really aren't going as well as they could for a certain group of people. But also we're hearing less from them. So about 3.5% of the UK population identifies as Black, but only 1.5% of the respondents on this survey were from a Black background. And so I'm so sorry, Marble, go. So I think there's probably more to do and more to think about in terms of how do we reach the people that we want to reach, the people that are potentially having a less good experience. How can we find out from them why that is, and what we can do to improve their experience? And that's going to be really important, especially as we go into the next year, I think. Age and gender, I think really interesting results in the CPES survey as well. So I was really interested to see that people in the 35 to 44 year age group were the least likely to say that they'd had a discussion with a member of their team about their needs and concerns. From my work at Shine, so obviously we support people in their 20s, 30s, and 40s. And I wonder whether that's because actually people in that age group have very different concerns than the vast majority of cancer patients. So it's about 1 in 10 cancer diagnoses occurs in the 25 to 49 age group. That's why we support them at Shine. But we know that those people tend to have young families. They might be in full-time work. They may be looking after an elderly parent. And very often, with older cancer patients who have paid off their mortgage, their children are grown up, they might be married or in a long-term relationship. Those are very different concerns. So I think there's something in there about how can we support people who are younger with cancer, especially because for some cancers, that's certainly a growing cohort. I was also really interested to see that men were more likely than women to say before their hormone therapy started that they had all the information they needed in a way they could understand. And that's something, I would love to unpick one day. Is it that women maybe aren't having their concerns addressed in the same way? Are men more likely to have fewer questions or just to feel that they're getting better answers. But there's something in there that comes up a few times, I think, about women maybe feeling that their concerns and their questions aren't being answered in the way that they would like. So I think, these are really important. And I know that if your results in certain areas aren't as good as you would like them to be, that can feel really disappointing. What I would love for you to do, though, is to take a step back and think, okay, this is what people have told us, so what we can do about it. I think often when in the NHS, when we do get poor patient feedback, what I hear is, well, we knew that already. I hear that all the time. Which begs the question of why no one's done anything about it. But we also hear, well, that can't have happened. They're saying that happened, but it didn't happen in that way. And actually, if people have taken the time to fill this survey out and give you their feedback, it is their experience of what happened. And I think we have a duty to do our best to understand what's happened and how it can be improved, or how we can build on the already great stuff that's happening. So if you're seeing that there's some really good stuff, find out why and how you can have more of it. And I just also wanted to touch on the fact that, there are different ways to get insights and feedback. CPES is one tool in your toolbox, but you will have the friends and family test, you will have inpatient surveys, you will have, GP data you can draw on, you will have a lot of other tools. But if you did want to do a slightly deeper dive into some of the feedback, say, for example, around, your Afro-Caribbean populations who perhaps have a less good experience of care, there's a lot of ways that you can do that. And I think there's something really important about being curious and open. So like I said, often we hear, oh, well, we already knew that, or, that can't have happened. But if you sort of step back and think, okay, well, why are you telling me that? Tell me a little bit more about what that is, and think about, who's given you feedback and who hasn't, but also how you can reach those people whose experiences you want to find out more about. Very often, I think it's easy to invite people into our world. So we might hold a workshop at a time of day or a place that suits us, but not necessarily at a time of day or a place that suits the population we want to reach. So can you work with other community groups to reach this population? Can you use online meetings instead of face-to-face? Or if you're going to use a face-to-face meeting, can you use some tools and techniques that make things a bit more fun? And I've just thrown in a few photos of some work that we've done at Shine. This was obviously pre-pandemic, but we did have therapy alpacas to come to one of our events. We're big fans of therapy animals, and actually therapy dogs you can usually get for free. So I'd really recommend that if people like dogs. But, doing things like world cafes and just different experiences or different opportunities to allow people to explain their experiences in different ways and to each other as well. And I'm happy to talk to anyone who wants to follow up with that, about any ideas that they might want to run by. I did also want to just talk about 3 issues that I think are coming. They're here now, but they're coming up for the year ahead. So a few weeks ago, I was actually asked to speak on the BBC radio show Money Box Live as an expert on the cost of cancer. And I put it out on Twitter. I said, just tell me what your experience of the cost of cancer is. And I was absolutely overwhelmed by the number of tweets I got. And I wrote out a list of all of the concerns people gave me, and it took up 3 A4 pages in my notebook. So the cost of living crisis is tough. It's going to be tough for everyone, but I think this winter is going to be really hard when you've got people who, their salary is being eroded by inflation. The cost of heat and electricity and gas has more than doubled. And we know cancer patients feel colder. So Macmillan, I think, has done some work that's just showing that, people are probably about £800 a month worse off through cancer. But when everything else is increasing, I think this is a really crucial issue, and it would be really great if you could think about how that might affect your patients, but also what you can do to support them. So, how are people getting to and from your appointments? Can any of them be virtual? Could you extend free parking? And do you know about all of the places you can signpost patients to support them as well? 2 other issues that have come up actually in the Shine community as well as online lately, are masking and visiting in hospitals. So these are really related to COVID. And obviously, the COVID situation is changing quite a lot. But where there have been restrictions on visiting, very often they are, you're only allowed one person who might be 12 and over. We have a lot of people who have young children who haven't been able to see their children while they're in hospital, and have to fight quite hard to try to find a solution to that. So are you able to look at that and maybe be a bit more flexible? It's really tough for people to be away from their kids and from their kids to be away from their parents. But also, I know a lot of hospitals have lifted mask mandates, but you can imagine from the point of view of a cancer patient, that can be very anxiety inducing, not just for people who are, immune compromised because they maybe have blood cancer, but if you're going into a hospital for cancer treatment, you don't want to catch COVID because it disrupts your ability to keep going with your treatment. And I've heard from quite a few people that they're finding this very difficult to navigate. And I appreciate that, whole hospitals have different approaches, but maybe thinking about whether or not that's something you can look at specifically for where cancer patients spend the most of their time. So just really briefly, I wanted to talk about the PPV Forum. So this is our Patient and Public Voices Forum for the NHS England Cancer Programme. So we're linked into the national team. We've got a great patient and public engagement manager named Rachel Lovesey. And our objectives are really about bringing on-the-ground intelligence from communities and people affected by cancer into the cancer program and vice versa. So we have members, we've got 35 members across the country at the moment. They are generally aligned to the Cancer Alliance. So if you know who your PPV member is, and they are in touch with, your patient engagement manager, great. If they aren't, we would love to hear from you and think about how we can work more effectively together, because I think while we definitely have a role in sort of, bringing some of the national level stuff to the alliance level, we would also love to have the reverse happen and hear what's going on for you and be able to bring that back to the national team. So we represent patients in the public voice within the National Cancer Programme. We're involved in a lot of different projects at the national level. So we were involved in the Task and Finish groups. We've been involved in the CPES awards. There's, faster diagnosis quality markers. We've got a really great team of people that are involved in a lot of different projects. So if you are able to get in touch with your PPV member, you're not just getting someone who might know about things going on locally. They will also have knowledge of some of these projects. And like I said here, we want to be better linked to the alliances and the ICS structures. And many of us also have experience beyond our own cancer experience. So we can help you work on how you involve your communities. We're really passionate about health inequalities, particularly within our own communities. So if you are looking at some of that data and thinking, oh, there are specific groups that aren't having as good an experience, we might be able to help with that. So please do get in touch with Rachel or myself if you'd like to find out more, and we can try to have a think about how we can link up a bit more effectively. So I just wanted to leave you with, this is my new favorite quote lately, but I don't know if any of you have seen Parks and Recreation, which is a TV show, it's on Amazon, and it's about a kind of hapless, low-level civil servant. But in one of the early episodes, she goes into a community meeting and she says, what I hear when I'm being yelled at is people caring loudly at me. So I just want you to hold on to that. When you look at your results, whether they're great or there are areas for improvement, just remember that it is actually people caring. They might be caring in a way that is tough to hear, but it comes from a good place. And I will wrap up there. These are my details if anyone wants to drop me an email, or I'm on Twitter. But yeah, thank you very much for having me, and I hope the rest of your day goes really well.